Marine Corps Air Station Iwakuni medical staff stepped up mother-infant care through exercises that better equip them to handle different scenarios in the delivery room. Commander Adam Saperstein, a Navy family physician with Naval Family Branch Health Clinic Iwakuni, says these drills improve their performance as a team.
So what you saw us doing were advanced life support and obstetrics and neonatal resuscitation drills. These are standards across the country for emergency resuscitation for moms and for babies. And we do these on a regular basis so that when we actually do have an emergency, we're ready to go and we know exactly what we're going to do. And we also know the choreography. We can anticipate what each other are going to do inside of the room at that moment in time, because in these situations, seconds can really matter.
The staff trained with an advanced simulation mannequin that simulates common scenarios that occur during birth.
Do you see any black spots or do you have any blurred vision?
Commander Saperstein also said these exercises not only help the mother and child, but also affect the military community as a whole.
You know, as a military member, and I'm married, I have 2 kids, one of the things that many military members are worried about when they're deployed or when they're TAD, when they're away from their base, is my family taken care of? And anytime that's the focus that I have, or that any of our military members have, it makes them less able to focus on the mission at hand. That's why this mission is so critical, so that we can assure them that we're taking care of their families as they would want them to be taken care of, and they have that reassurance that we've got their back.
All right.
The Mother-Infant Care Center has 6 labor, delivery, recovery, and postpartum suites, each equipped with a neonatal resuscitation chamber for any emergencies. Reporting from Marine Corps Air Station Iwakuni, Japan, I'm PFC Katie Curtis.
That's good. Suction simulate. Suction.